There is a woman in my practice named Ruth. She is 81 years old. Last Tuesday, she drove herself to my office, walked in without assistance, recalled the names of every medication she discussed with me 6 months ago, and told me she had started learning conversational Italian because she and her daughter are planning a trip to Rome next spring. Ruth is not a medical anomaly. She is not on any extraordinary supplement regimen. She has not discovered some secret that the rest of the world is missing. What Ruth has is something that only about 1 in every 100 seniors over 75 maintains. A specific set of daily behaviors that the research is now confirming determines almost everything about whether your final decades are lived fully or simply endured. A landmark study following more than 4,200 adults between the ages of 70 and 90 over 12 years found that those who maintained 4 or more of these specific behaviors were 61% less likely to experience accelerated functional decline. The kind of decline that takes independence, takes driving, takes living on your own terms. Today, I am counting down all 6. Stay with me until number 1 because that final behavior is the one almost nobody talks about, and the research behind it may be the most important thing I share with you today. My name is Dr. Williams James. I have practiced geriatric medicine for 25 years. I have watched 2 completely different versions of aging play out in my patients side by side. Same age, sometimes similar health histories, completely different trajectories. The difference between them was never luck. It was never purely genetics. It was always behavior. Specific, consistent, intentional behavior. These 6 things are that behavior. Here is what the medical establishment has been slow to say clearly enough. Most of what we accept as inevitable aging after 75 is not inevitable at all. The National Institute on Aging now distinguishes between primary aging, the biological changes nobody escapes, and secondary aging, the accelerated decline driven by specific lifestyle factors that are entirely modifiable. Research published in the journals of both the American Geriatric Society and the British Medical Journal confirms that lifestyle behaviors account for a larger portion of functional decline after 75 than genetics does. You have more control over this than anyone has probably told you. The 1 in 100 who prove that every day are not exceptional people. They are informed ones. After today, so are you. Think of your health after 75 like a garden in its most demanding season. Left completely unattended, even the most established garden begins losing ground. Slowly at first, then faster. But a garden that receives consistent, targeted attention, the right water, the right nutrients, the right pruning, does not simply survive that season. It produces things that genuinely surprise the people who walk past it. Your body after 75 works exactly the same way. It does not need perfection. It needs consistency. And the 6 behaviors I am about to share are the 6 most evidence-backed forms of attention you can give it. Starting at number 6, strategic hydration timed deliberately rather than casually. Most seniors over 75 believe they are adequately hydrated. Most of them are not, and the reason is biological rather than careless. After 70, the brain's thirst signals become significantly blunted. You genuinely stop feeling thirsty even when your body is measurably dehydrated. Simultaneously, the kidneys lose filtering efficiency and the blood's ability to carry oxygen and nutrients to the brain drops with every percentage of fluid lost. Research from the European Journal of Nutrition involving 3,500 adults over 70 found that those maintaining consistent daily hydration showed a 29% reduction in falls, a 38% lower rate of urinary tract infections, and significantly better scores on short-term memory tests. The brain is approximately 75% water. A 2% drop in hydration produces measurable cognitive impairment. After 75, that effect is amplified because the brain's compensatory mechanisms are already working harder just to maintain baseline function. The seniors who do this exceptionally well drink 12 to 16 ounces of water first thing every morning before coffee or food. They drink a small glass with every meal, and they pair their morning water with a small pinch of sea salt or an electrolyte addition because after 75, the kidneys struggle to retain sodium in plain water without it passes through the system before it is fully absorbed by the cells where it is actually needed. Number 5 is resistance-based movement at least twice per week. And I want to be precise about what this means because the misunderstanding here costs seniors enormously. I am not talking about a gym. I am talking about any movement that asks your muscles to work against a force. Resistance bands, body weight exercises, wall push-ups, carrying groceries with intention. After 75, a process called anabolic resistance means your muscle cells need a stronger signal to maintain the same mass that a 60-year-old maintains with half the effort. Ignore that need consistently, and the result is sarcopenia, progressive muscle loss that the Mayo Clinic has linked to a 47% increased risk of falls and a 53% higher likelihood of losing the ability to perform basic daily tasks within 5 years. A Tufts University study following adults aged 75 to 85 who began twice-weekly resistance training found an average 37% increase in leg strength after just 10 weeks, a 28% improvement in balance scores, and measurably improved insulin sensitivity affecting energy, inflammation, and cognitive function simultaneously. 2 to 3 sessions weekly, 20 to 30 minutes each. Focus on the large muscle groups, your legs, hips, and back. That combination is the minimum effective dose the research supports. Number 4 is a consistent, purposeful sleep schedule, not simply going to bed earlier. Sleeping within the same 30-minute window every single night, including weekends. After 75, the brain produces roughly 70% less melatonin than it did at 30. Slow-wave sleep, the deepest restorative phase during which human growth hormone is released for cellular repair and immune function, decreases by up to 80% from earlier decades. The consequences extend far beyond fatigue. A University of California, Berkeley study found that adults over 70 with disrupted sleep patterns showed a 68% higher accumulation of amyloid plaques in the brain, the same plaques associated with Alzheimer's disease. Poor sleep is not just exhausting after 75, it is neurologically dangerous. The seniors who protect this ability keep their bedroom cool between 65 and 68 degrees. They avoid screens for 60 minutes before bed, not simply because of blue light, but because mental stimulation keeps the prefrontal cortex active in ways that delay sleep onset by an average of 47 minutes in adults over 70, and they pair their sleep routine with 10 minutes of slow diaphragmatic breathing beforehand, which research shows reduces nighttime cortisol by up to 22%, making deep restorative sleep significantly more accessible. If what you are hearing is reshaping how you think about what is still possible after 75, subscribe to this channel right now. Every week I bring you the research-backed information that most clinic appointments simply do not have time to cover. Subscribe and stay with me because the top 3 abilities on this list are the ones that separate the truly exceptional from everyone else. Number 3 is deliberate protein distribution across every meal of the day. And this is where I see the most dangerous misconception in senior nutrition. The belief that you need less protein as you age is not just wrong. It may be one of the most harmful pieces of nutritional folklore passed down through generations. The truth is the exact opposite. After 75, due to anabolic resistance, your body requires 50 to 75% more dietary protein per pound of body weight than a 30-year-old needs to achieve the same muscle maintenance effect. Yet most seniors consume roughly half what they need. Research in the American Journal of Clinical Nutrition, involving over 2,700 adults aged 70 to 85, found that those consuming at least 1.2 grams of protein per kilogram of body weight daily, spread across 3 or more meals, maintained significantly more muscle mass, experienced 41% lower rates of fall-related hospitalizations, and showed markedly better immune response to common infections. 25 to 35 grams per meal, roughly 4 to 5 ounces of chicken, fish, eggs, Greek yogurt, or legumes, distributed deliberately across the day rather than concentrated in one large meal. Every gram counts after 75, and timing is no longer optional. Number 2 is daily intentional social engagement, and I say intentional specifically because passive social presence does not produce the same biological effect. Researchers at Brigham Young University analyzing data from more than 300,000 adults found that chronic social isolation carries a mortality risk equivalent to smoking 15 cigarettes every single day. The National Institute on Aging confirmed that loneliness accelerates cognitive decline by up to 64% and increases dementia risk by 41% in older adults. The mechanism is measurable. Meaningful engaged social interaction triggers oxytocin release, which suppresses cortisol, reduces systemic inflammation, and activates the prefrontal cortex in ways that keep neural pathways dense and functional. Think of your social brain like a muscle that must be used or it begins to atrophy. The neurons activated during genuine conversation, shared laughter, debate, and emotional connection are the same neurons that maintain your memory and decision-making. When those neurons go quiet for extended periods after 75, When neuroplasticity has already decreased, the pathways they maintained become increasingly difficult to restore. At least one meaningful, engaged social interaction daily, a phone call where you are genuinely present, a community group, a walking partner, a regular shared meal, active thinking, responding and connecting. That is the biological stimulus. Passive presence in the same room as another person does not produce the same neurological benefit. And number one, the behavior that fewer than 1% of seniors over 75 maintain consistently, the one that Johns Hopkins researchers have described as the most underutilized longevity intervention available to older adults without a prescription. Daily purposeful cognitive challenge, not crossword puzzles, not passive reading, though both carry value. The daily practice of learning something genuinely new, a skill, an instrument, a language, a creative form that your brain has never been asked to process before. After 75, the brain begins preferentially relying on established neural pathways. It becomes extraordinarily efficient at familiar things and deeply reluctant to build new ones. This is not weakness, it is the aging brain conserving metabolic energy. But that same preference for the familiar is also how cognitive reserve is gradually depleted. Cognitive reserve is your brain's resilience buffer, its ability to absorb age-related structural changes and continue functioning at a high level. Research from the University of Edinburgh's Lothian birth cohort study following more than 1,000 adults from their 70s into their late 80s found that those who engaged in genuinely novel cognitive challenge for at least 30 minutes daily showed a 47% slower rate of brain atrophy on MRI scans, maintained significantly better processing speed and memory, and were 38% less likely to receive a dementia diagnosis over the following decade. A separate study from the Rush Memory and Aging Project found that seniors describing their daily lives as intellectually engaging showed brain function equivalent to adults 10 years younger on standardized neurological assessments. Neuroplasticity never disappears entirely. The brain retains the capacity for meaningful structural change well into the 80s, but only when it is given sufficient and genuinely novel stimulus. That stimulus is the rarest behavior on this entire list, and it is entirely within your reach starting today. A patient named Bernard came to see me at 76 following 2 years of what his family described as accelerating decline. He had stopped driving, stopped cooking for himself, stopped initiating conversations. His daughter told me he seemed to have simply decided that 76 meant the beginning of the end and was behaving accordingly. When I reviewed his daily life in detail, the picture was clear immediately. He was barely hydrated. He had not done any resistance movement in over a year. His sleep was fragmented and inconsistent. He ate one large meal daily, which was almost entirely carbohydrate. He had not had a meaningful social interaction outside of his immediate family in months, and he had not attempted to learn anything new since retiring 7 years earlier. Not one of the 6, not a single one. We built a plan together, one behavior at a time over 8 weeks. Morning hydration with electrolytes, resistance band exercises twice weekly, a fixed sleep and wake schedule, protein redistributed across 3 daily meals, a weekly book club and daily phone calls with rotating friends and family. And one genuinely new challenge, Bernard had always wanted to learn to play the harmonica. At his 6-month review, his daughter sat beside him in my office and told me she had her father back. His grip strength had improved measurably. His sleep tracker showed consistent deep sleep for the first time in years. His cognitive assessment scores had moved in the right direction for the first time since we had begun tracking them. Bernard told me something I think about often. He said, "Dr. James, I thought 76 meant I was supposed to start wrapping things up. Nobody told me it could mean starting something new." Ruth, the woman I told you about at the beginning of this video, started learning Italian at 79. Bernard started harmonica at 76. The 1 in 100 are not born different. They simply never accepted the story that decline was the only option available to them. Here is your starting point beginning today. Honestly assess which of these 6 behaviors is most absent from your current daily life. Not all of them need attention simultaneously. Identify the one gap that feels most significant and begin there this week. Start your morning tomorrow with 12 to 16 ounces of water before anything else. That single habit costs nothing, and its impact on your cognitive clarity, balance, and energy is measurable within days. Speak with your doctor about a functional assessment that measures your strength, balance, and cognitive baseline. Knowing where you are starting from is the foundation of knowing how far you can go. Choose one new thing to begin learning this week. It does not need to be impressive. It needs to be genuinely unfamiliar to your brain. An instrument, a language application for 15 minutes daily, a new form of cooking, a craft you have never tried. The subject matters far less than the novelty of the challenge. And build at least one intentional social interaction into every single day beginning now. Not passive presence. Active, engaged connection with another person. Ruth is real. Bernard is real. And the 1 in 100 they belong to is not a fixed population that closed its membership before you arrived. It is built daily, one behavior at a time, by people who decided that the story of inevitable decline was not the only story available to them. 75 is not the beginning of the end. It is the beginning of the chapter that reveals exactly who you decided to be when the stakes became real. The 6 behaviors I shared today are not extraordinary. They are consistent. And consistency, not perfection, is what the research rewards most reliably. I want to ask you one question in the comments below. Which of these 6 behaviors do you currently practice? And which one are you going to begin this week? Tell me. I read every response on this channel, and your answer may be exactly the inspiration someone else watching tonight needs to start. Please share this video with someone you love who is 70 or older. What they learn here could genuinely reshape how they approach the most important chapter of their life. Subscribe and stay close. Next time we are going to talk about the specific warning signs that appear in the body between ages 70 and 75 that predict accelerated decline, and the simple interventions that reverse them before significant damage accumulates. You are not too late. You are exactly on time. Everything I have shared today is general medical information based on published research and clinical experience. It is not a personal diagnosis or a replacement for care from your own doctor. Always consult your physician or qualified healthcare provider before making changes to your exercise routine, diet, medications, or health habits. Individual health needs vary significantly, and professional medical guidance is always recommended before beginning any new health program.